Hello, today we shall be discussing postmenopausal bleeding. Postmenopausal bleeding means the bleeding that happens after the menopause is attained. This bleeding is never normal and one should visit a gynecologist to check for the cause and how it can be treated. Now, the commonest cause of postmenopausal bleeding are: one is vaginal atrophy, as in after the menopause the hormones of the body are, and so there is vaginal dryness. Second cause is polyps. Small polyps can be seen in the uterus which cause such a bleeding. Uterine cancers, cervical cancers, yes, they are very important causes of cervical and uterine bleeding seen postmenopausally. These account for around 8 to 12% of the women with postmenopausal bleeding. So roughly 1 in 10 of the women with postmenopausal bleeding have a likelihood of cancers. Hence, it is very important that we go ahead with at least a gynecological examination where the doctor sees and figures out the cause. Ultrasound is another modality which is required, a test which can pick up few of these causes. Then for the treatment and to get a biopsy, hysteroscopy is needed. In hysteroscopy, a camera is passed through the uterus, as one can see here. So a camera is passed through the uterus and we can have a look inside of the various problems which could cause such a bleeding. And in the same sitting, treatment is also possible, as in the polyp can be removed and other biopsies and all can be taken. Now, you can see in this video, the woman came with postmenopausal bleeding at the age of 67-68, and there is uterine cancer which can be seen when taken a look via hysteroscopy. This video shows that there is a polyp which is there in the uterus and I have removed this polyp. So the treatment is done after removal of the polyp. Whereas if it's a cancer, then the further treatment and further management is needed. So the take home message is that whenever there is bleeding after 2 years, 4 years, 10 years, 20 years after menopause, one should not ignore it and take the opinion of the specialist in the matter and find symptoms relieved. Thank you.